Welcome all. Today we will talk about the veins. Veins are those blood vessels which return the blood from the tissues to the heart. Their walls are thinner than the arteries. The contracting skeletal muscles compress the veins, directing the blood towards the heart. The smallest veins are called venules. These tributaries unite to form larger veins, which sometimes join to form venous plexus or networks. For example, dorsal venous arch of foot. The veins that accompany muscular arteries, one on each side, are called venae comitatus. In Latin, it means accompanying veins. Many veins contain valves, which prevent the backflow of blood. The valves support the columns of blood superior to them, example in the legs, and to divide these columns into smaller amounts of less weight. This facilitates the return of blood to the heart and prevents pooling of blood. So, in general, we know that the veins carry deoxygenated blood, that is, the blood which is low in oxygen content. But the pulmonary veins and portal veins are exceptions. The pulmonary veins carry oxygenated blood, whereas the portal vein carries the products of digestion, that is, the carbohydrates, fats, and proteins from the intestine. And they carry the products of red cell destruction from the spleen. The factors affecting the venous return are the pumping action of heart, the thoracic pump, and the skeletal muscle pump. The veins of the body can be discussed under the following headings: veins of head and neck, veins of the upper limb, veins of the thorax, veins of the abdomen, and veins of the lower limb. Coming to the veins of head and neck. Veins of face. The external facial veins accompany the arteries of the face and they anastomose freely. They are supratrochlear vein, supraorbital vein, facial vein, superficial temporal vein. The applied anatomy of facial vein is that it has connections with the cavernous sinus and also the pterygoid venous plexus. So, if there is any infection in the facial veins, this can reach the intracranial aspect as well. The veins of the skull are dural venous sinuses, internal jugular vein. The example for the dural venous sinuses are cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus. The unpaired dural venous sinuses are superior sagittal sinus, inferior sagittal sinus, the straight sinus, occipital sinus, the anterior and posterior intercavernous sinus. The veins of the neck are anterior jugular vein, external jugular vein, and subclavian vein. Coming to the veins of the upper limb, there are superficial veins and there are deep veins. The superficial veins are basilic vein, cephalic vein, median cubital vein, and the median vein of the forearm. The median cubital vein is connected to the deep veins by a perforator vein. The perforator vein fixes the median cubital vein and thus makes it ideal for the intravenous injections. Also for withdrawing blood for biochemical and pathological studies and for withdrawing blood from donors. The deep veins accompany the arteries. They are arranged as venae comitatus. Coming to the veins of the thorax, they are the brachiocephalic vein, superior vena cava, and azygos system of veins. Azygos means unpaired. The veins of this group are azygos vein, hemiazygos vein, and accessory hemiazygos vein. The infection and tumors from the abdomen and thorax can spread along the azygos vein to different parts of the body. The veins of the lower end of esophagus drain into the left gastric vein, which drains into the portal vein. The azygos vein, which drains into superior vena cava, is a systemic vein. So there is a portosystemic anastomosis at the lower end of the esophagus. In portal obstruction, these veins dilate, forming esophageal varices, which can give rise to massive hemorrhage. We will see more of the portosystemic anastomosis in the veins of abdomen. The veins of abdomen are the inferior vena cava and the portal vein. Inferior vena cava is the largest vein in the body, and it returns blood from the lower limbs, most of the abdominal wall, and abdominopelvic viscera. The tributaries of inferior vena cava, they are the common iliac veins, the lumbar veins, the right testicular or ovarian vein, the renal vein, the right suprarenal vein, the hepatic vein, and the azygos vein. The obstruction of the IVC or the inferior vena cava due to thrombosis below the level of renal veins causes edema of the lower limbs. Obstruction of inferior vena cava above the level of renal veins cause edema of lower limbs, albuminuria, and ascites. Tumors of head of pancreas can compress the inferior vena cava and can cause obstruction. In inferior vena caval obstruction, the blood is bypassed along the azygos venous system and vertebral system of veins. Coming to portal vein. Portal vein is a main channel of portal system of veins. It is peculiar in that it starts in capillaries and ends in venous sinusoids of the liver, and it has no valves. The portal vein collects blood from the abdominal part of gastrointestinal tract, the gallbladder, the pancreas, the spleen, and carries it to the liver. In the liver, it branches and rebranches to end in expanded capillaries or sinusoids. From the sinusoids, the blood is collected by hepatic veins which drain into the inferior vena cava. The contents of portal venous blood are the products of digestion, that is a carbohydrate, fat and protein from intestine, and products of destruction of RBCs from spleen. The right branch of portal vein receives the cystic vein. The left branch receives ligamentum teres, that is the obliterated left umbilical vein. Some small veins accompanying the ligamentum teres called paraumbilical veins, and the ligamentum venosum, that is a remnant of ductus venosus extending from the left branch of portal vein to the IVC. At the porta hepatis, the portal vein divides into right and left branches which enter the right and left lobes of liver. That is how we get the right branch of portal vein and the left branch of portal vein. Now coming to the tributaries, they are the left gastric vein, the right gastric vein, the cystic vein, the paraumbilical veins, the superior mesenteric vein which receives tributaries from the areas supplied by superior mesenteric artery and also the right gastroepiploic vein, the splenic vein. The tributaries correspond to the branches of the splenic artery. The inferior mesenteric vein also drains into the splenic vein. important to know about the communications between the portal and systemic veins, which is also called as the portosystemic anastomosis. There are some areas where the portal system of veins communicate with the systemic veins. They are as follows. At the lower end of esophagus, the anterior abdominal wall, and the anal canal. At the lower end of esophagus, the venous plexus in the submucosa of lower end of esophagus drains inferiorly into the left gastric vein, which ends in the portal vein, and superiorly into the azygos venous system, which in turn ends in the superior vena cava. So that forms the systemic part of it. The superficial veins of anterior abdominal wall radiate from umbilicus to drain into the axillary vein, saphenous vein, or along the paraumbilical vein into the portal vein. In the anal canal, there are submucous venous plexus. These plexus drain below into the inferior and middle rectal veins, which ultimately drain into the internal iliac and inferior vena cava. Superiorly, the plexus is drained by the superior rectal vein, which continues as the inferior mesenteric vein and drains into the splenic vein. That forms a portal part of it. So here you can see the lower end of esophagus. You can see the anal canal, that is B. The anterior abdominal wall is not shown here, but you can see caput medusae marked as C. We will come to that later. So what happens in portal obstruction? In portal obstruction, it will lead to esophageal varices, caput medusae in the anterior abdominal wall, and hemorrhoids or piles in the anal canal. Here is a picture of esophageal varices. In portal obstruction, due to backflow of blood through the venous plexus in the submucosa of lower end of esophagus into the systemic circulation, the submucous venous plexus become varicosed. They are called as esophageal varices. It can give rise to massive hemorrhage if ruptured. Here we can see caput medusae. Caput medusae means the head of Medusa. Medusa is a Greek mythological character. So the radiating veins around the umbilicus will become dilated and tortuous in portal obstruction, and it will look like a Medusa head. And in anal canal, the submucous venous plexus will bulge to form hemorrhoids or piles in portal obstruction. So you should know about this portosystemic anastomosis very well. It's very important to know about it. What are the causes of portal obstruction? They are the cirrhosis of liver and thrombosis of portal vein. Surgical treatment for the portosystemic obstruction is portocaval shunt. So there is anastomosis between the, or we are making an anastomosis between the portal vein directly to the inferior vena cava, so that we can bypass the obstruction. Coming to the veins of lower limb, there are superficial veins, deep veins, and the perforating veins. The superficial veins consist mainly of great and small saphenous veins. The deep veins accompany the arteries. They are surrounded and supported by powerful muscles. They are the tibial, popliteal, and femoral veins. Below the knee, the deep veins are arranged as pair of venae comitatus. Above the knee, they form a single large vessel. The perforating veins communicate the superficial with the deep veins. All the veins of the lower limb are provided with valves to direct the blood flow to the heart against gravity. Coming to the applied anatomy of superficial veins. We can see varicose veins and venous thrombosis. Varicose veins is dilated and tortuous veins. The causes are incompetency of valves, thrombosis of deep veins, and persistent elevation of intra-abdominal pressure as in case of abdominal tumors or multiple pregnancy. Another use of great saphenous vein is that it can be used as a graft in coronary bypass surgery. Also, venesection in emergencies can be carried out in the lower part of great saphenous vein. Venous thrombosis. It can be superficial venous thrombosis or deep vein thrombosis. The superficial vein thrombosis is also known as thrombophlebitis, and it commonly occurs in varicose veins or in veins which are cannulated for intravenous infusion. A painful cord-like inflamed area is diagnostic of thrombophlebitis. The deep vein thrombosis may follow childbirth, operations, local trauma, immobility, or any debilitating illness. So what will happen? The thrombus may form in the tributary of a main vein. It gradually extends into the deep vein. The relatively faster bloodstream may cause a portion of this thrombus to break off and cause a pulmonary embolism. Calf veins and pelvic veins are commonly affected. That's all for today. Thank you.